Hello everyone, welcome to this Facebook live session. First of all, greetings from Aster CMI Hospital. I am Dr. Gunnar Srinivas. I am a consultant at Pediatric Emergency and Pediatrics at Aster CMI Hospital. Today is International Childhood Cancer Day, and this year's theme is uh, for survivals, mainly focusing on what all measures we can do to improve the survival. That is this year's theme, and to have a discussion on cancer and all other aspects. Today we have Dr. Stalin here.
Hello.
He's a pediatric hemato-oncologist. Welcome, Dr. Stalin, to this session. So he has been trained at Madurai Medical College in the undergraduation, and he has received his training in pediatric hemato-oncology. That is training on cancer for the children part from the UK, and he has an extensive experience of 21 years now. I think we will have a lot of knowledge being shared from Dr. Stalin today. So once again, welcome. I welcome all the audience for this session. So let's start our discussion on this childhood cancer. We'll be busting few myths and providing some information so that its awareness is created on this important topic on childhood cancer. So basically, you are a pediatric hemato-oncologist.
Correct.
What exactly do you deal with hemato-oncology?
Yes. So basically, oncology is the field of blood disorders, and oncology is for cancer. So when I say pediatric hematology oncology, we deal with children's who has got problem with blood disorders, and childhood cancers, and that is what we specialize in, because these are rare situations. So we need a specialist who is experienced in this area to deal with these conditions.
Okay. So I think it's a common myth that cancer is common only in adults, right?
Yeah.
So please tell us, like, how common is this cancer in children?
Right. So you're absolutely right. The cancer in adults is much more common phenomenon. So that is why people often relate cancer to the older age. But in children, it is rare, but it does happen. So in terms of numbers, it is much less than the adults. But say, for example, in a state of Karnataka, in a year you may have about 700 or 750 new patients with cancer. So that is it gives you a rough idea how common it is in children.
Okay, fine. So now that we know that cancer is not very rare in children, like it's quite common, we are seeing. So what exactly is cancer?
Right. So cancer, even though everybody has got a little idea what it is, but people don't really understand what exactly that is. So cancer is a situation where a cell starts dividing out of control. In all our body, you know that our body is made up of a number of cells, and they keep dividing normally whenever they need to, and then they stop dividing whenever they don't need to. But in cancer, what happens? Probably it starts with one cell, and the one cell goes out of control. It doesn't obey the normal signals, and it keeps on dividing on its own and without control, and that's what we call as a cancer.
So you have seen that one cell going out of control is creating a lot of problem. So what are the common types of cancer we see in children?
Right. So in children, the spectrum of the cancers are slightly different from that of the adult cancers. Say, for example, leukemias, which is a kind of blood cancer, is very common in children. So that is almost forms 1/3 of all childhood cancers. And the next commonest tumor in children is brain tumors. So about 1/4 of all the cancers in children will be brain tumors. So other than that, there are a lot of other solid tumors. To name a few, lymphoma, kidney tumors like Wilms tumor, neuroblastoma, and there are a lot of other sort of rarer cancers which can happen in children.
Okay. So blood is the most common. So I think that's an important message for this question. So now, being a pediatrician myself, I have seen that I handle all the common conditions. Then when the common conditions don't respond as I expect and they're getting prolonged, that's when I always suspect, and then you have to rescue. Maybe for our audience awareness, can you just tell me what are those red flag symptoms you have to watch out for so that we have to think about cancer and then refer to you early?
Yes. So unfortunately, there are no symptoms which are specific for cancer, that it only happens in cancer. So, pediatricians often have to pick up these subtle signs where it is not the normal case and there is something unusual about it, and then that is the first suspicion. That is what is important. To sort of name a few, any fever in a child lasting for more than 2 weeks or 2.5 weeks, with all the investigations being normal, cancer should be considered as one of the possibility. And sometimes unexplained joint pains and bone pains, that could also be feature of a cancer. And any lumps anywhere in the body which is not responding to the treatment, which is continuously growing or slowly growing over a period of time, that also has to alert to the possibility of that being a cancer. And a lot of the times in childhood cancers, it is found incidentally, which means the patient has gone to doctor for something else, and the doctor feels the tummy and then feels that there is some swelling there in the tummy, and then does the scans, and that is how it gets picked up. So sometimes cancer can present in a way which parents may not have picked it up at all. And one of the important thing which everybody has to remember is about the brain tumors, because the brain tumors can present in various ways. So the commonest things which the red flags everybody needs to be aware of is if there is a combination of headache and repeated vomiting, or if there is a personality change, or the child who was walking well suddenly starts walking, or if there's a new onset squint, or child complains of double vision. So these are the things which will point towards a brain tumor. So if somebody picks it up quickly, then it can make an enormous difference in terms of treatment and outcomes.
Yeah, okay. I think I think that I would like to add here, saying that when we see kids, right, and they are not responding to our usual treatment, it's more important for the parents to come back and give feedback to us, saying the child has not got better or the child is progressing. Instead of coming back and giving us a feedback, if we have seen that no, the symptoms are not better, the parents might change doctors. So that might delay the picking up of this sign. So I think one important message is that if you always go back to pediatrician, give feedback and what is the progression of symptoms, it will be very easy for us pediatricians to even pick up those things, those which are red flag symptoms are there, red flag signs are there, and we can give a refer early to a relevant specialist, especially our hemato-oncologist, and the care can continue. Yeah, so that please make sure you all remember that. Now coming to okay, I have seen a child in my practice as a child, some symptoms and not getting better as what he told. I'm getting to see some red flag signs. I discuss with the parents. Now I decide, yeah, it's right time to refer to Dr. Stalin or oncologist. Now, Dr. Stalin, tell me what exactly happens when I explain the parents and refer to you. What exactly happens with you?
Right. So when we receive the patient from a referring doctor, sometimes the diagnosis is clear, but majority of the occasions the diagnosis will not be clear. There will be a suspicion of possibility of a malignancy or a cancer, but we have not confirmed that yet. So we would go through the history, have a thorough clinical examination, review all the blood tests and scans which has been done before, and then we will plan further investigations to confirm the diagnosis. So for majority of the cancers, the confirmatory test comes from what we call as a biopsy. We have to take a small piece from the swelling or cancer, or in case of blood cancer, a bone marrow, and then we have to check for the evidence of malignancy. So that is a final confirmatory test to say this patient has got cancer or not, and if so, what type of cancer it is. And the another important thing is then we also will do an assessment to see where all it has spread. So in the solid tumors, we will call this as staging investigations, where we may do different types of scans, CTs, PET CT, MRI, and so on and so forth. So that is to define the extent and where all it has spread. And sometimes we may do a lumbar puncture where we take some fluid from the back to see whether the cancer cells have gone to fluid around the brain. So those kind of staging investigations needs to happen. So a lot of specialist investigations happens to find out exactly what type of cancer it is.
So this is like now you have decided that okay, the child has a cancer, right? So once you're diagnosed, so how will the journey go ahead?
Right. So it entirely depends on the type of cancer. So every cancer, the treatment is very different. For example, if it's a blood cancer, most of the treatment is going to be chemotherapy, which is a medicine based. And some cancers, surgery will form an important part of treatment. And in some cancers, we will also have to use something called radiotherapy, which is an X-ray treatment to cure the cancer. So how much we use and what is the duration of the treatment, everything is going to depend on the diagnosis and what stage it is, and so on and so forth. Your pediatric oncologist will have a detailed discussion about this once the diagnosis and the staging investigations are completed.
I think at this point, usually the family sometimes come back to the pediatrician and express this concern. Sometimes they may not have understood, or they say, okay, doctor has told me about the chemotherapy, doctors told me about radiotherapy. The common question what we see is when they come for follow-up, especially for vaccination or some intercurrent illnesses, they say, doctor, my child is so small and tender. Will the child tolerate this chemotherapy, radiotherapy? I think we have to just create some awareness on
Yes, so that is one of the many parents ask this same question to me as well. My child is so young, will they tolerate the chemotherapy? But the good thing is, actually, because the child is young, all the organs, your heart, liver, kidney, the organs are much younger, and they actually cope with the chemotherapy much better than the adult patients. For the same reason, actually, as pediatric hematologist oncologist, we give a far more chemotherapy to the children than what an adult physician will be able to give because of the limitations they have. So our patients tolerate the chemotherapy very well. They may have developed some side effects, but in fact they actually tolerate it very well. And usually in most of the situations, once the cancer is cured, 4 or 5 years down the line, most of the time other people will not be able to tell the difference between another normal child and the child who had been treated for cancer before. Oh, wow. So they most of the time they do quite well.
So you mentioned about this chemotherapy, radiotherapy. What are these common side effects usually seen in children?
Right. So the chemotherapy are a kind of medications which are used to treat cancer. Basically, what they do is they go and kill all the fast dividing cells. And because most of the cancer cells are fast dividing, they attack those cells and destroy them. But there are also some other fast dividing cells in our body, and those are also going to get affected because of the drugs. So some of the common ones are that your bone marrow, which makes a lot of the cells all the time, so that will go under suppression, which means they will not be able to make the red cells, white cells, and platelets. For which reason we may have to give a blood transfusion or platelet transfusion, or when the white cell goes down, they may develop a fever, and we may have to treat the fever by admitting the patient and giving intravenous antibiotics. And also you can have some mouth ulcers, loose stools, and the cells which make the hair, they are also fast dividing. So the children on treatment may lose the hair during the treatment, but eventually it will come back. And other than that, you can have some vomiting and other things because of the direct effect of the medication. Most of the time it is managed with other medications to counteract these problems.
Yes, I definitely agree with Dr. Stalin. So chemotherapy, radiotherapy is, when the child is diagnosed with cancer, we definitely have to take those treatments. And we usually work with oncologist, with Dr. Stalin and their team to make sure we support the care. Especially, they might have some vomitings, as you mentioned. They might have other, they might require some transfusions, as I was saying, in the bone marrow gets suppressed. So we support all this and make sure that the journey is kind of smooth and safe, right? So now you're told about chemotherapy, radiotherapy, right? So how long does this whole treatment actually continue?
That very much depends on the type of the diagnosis and what is our diagnosis. So the treatment can vary from about 6 months to even up to 3 years. It is based on the diagnosis. For example, some of the leukemias, we will treat it for 3 years, but the first 6 months is going to be the intensive treatment. So somewhere along those lines, so somewhere between 6 months to 3 years, depending on the type of cancer which was diagnosed.
So now that we have understood how the child presents, what symptoms the cancer present in children, the way they are diagnosed, the way they are treated, I think everyone would have had a kind of myth or stigma, what we call, that cancer is incurable, right? I think I would like you to bust that myth. Is cancer incurable in children? or how different is it compared to adults?
Right. Now that's a very good question. Actually, cancer is very much curable in children, and it is the outcomes are improving all the time. So, say for example, if you take some 40, 50 years ago, a majority of the patients will not make it once they develop a cancer, but now it is reverse. So only minority of the patients don't survive. So the cancer survival varies in children varies between sort of 60-70% up to 90% based on the type of the cancer again. So finally the diagnosis is what is very important. But unfortunately, if any of the viewers or the relatives, children got diagnosed with cancer, you can be reasonably be sure that majority of the children do well. They get cured of the cancer and they go on to live a normal life in the future.
I think that's a very reassuring message. I think I would like to stress here that that whatever myth we have that cancer, once cancer is there, it's incurable, it's like end of the road. But make sure that it is not, that is the kind of misinformation or myth. The proper information, I think you heard just now from Dr. Stalin, up to 90% based on certain types of cancer, they are completely curable in children, right? So that's actually, I think, highlight of this whole session. So now, once like they're cured, are they going to have any long-term health problems?
Right. So majority of the patients will not have long-term side effects, but there are some side effects because of the intensity of the treatment that is needed. For example, a risk of infertility, because the medicines which we give to kill the cancer cells also will affect the sperm and ova even at that earlier stage. They may have difficulty in having children later. I mean, it's not 100%. Definitely, there's a chance of having a child, but the chance is reduced compared to a normal person. So that is one of the common risks which we tell to the families when we start the treatment for cancer. And other than that, if there is some residual effect, say because of the surgery or radiotherapy, so there can be some long-standing side effects, especially if the radiotherapy has to be given in children less than 3 years, then it affects them significantly. So most of the time we try to avoid radiotherapy under 3 years of age. Older children will tolerate it reasonably well. And sometimes there is a small risk of increased risk of cancer because of the treatment which was given to treat the previous cancer. So there is a slightly increased risk compared to the general population. But having said that, majority of the patients have their cancer cured and they go on to live a normal life.
Okay. I think the key is whatever the side effects can be there, they all are treatable, right? And long-term effects are not, they are very less percentage compared to the benefit it's going to give, especially the up to 90% survival, right? That's the thing. So now that they have, like you have told us about the way the treatment works, the way the improved survival rate compared to previous years, that's the advances we are having. So now I think I'm sure that when they come for follow-up, I've seen a couple of parents asking, especially that I have a family member affected with cancer in my family, right? My grandfather had a cancer, right? Grandmother had a cancer, or some other relative had a cancer. Child is absolutely fine now, but does that mean that child has increased risk of cancer? How is it related actually?
Right. So it's a very good question. A lot of parents sometimes feel guilty or they think about it a lot, whether they have given the cancer to the child. What I can reassure is, in majority of the cases, cancer is not inherited from the family members or grandfathers or whatever, and most of the time the relation between the adult cancer and childhood cancer is very rare, and often you see that the adult cancers, a lot of them are dependent on the environmental influences, say for example smoking, exposure to chemicals and all those things. But most of the time in children the cancers come from within, and most of the time there is no clear reason. Minority of the patients may have some cancer predisposition because of they inherited some genes which may have made them more prone for cancer. But in majority of the patients there is no cause which we can find out which caused the cancer. And also cancer cannot be given from one person to the other person. So if a brother developed a cancer, it doesn't mean that the sister is at increased risk of developing cancer.
I think what the important thing you have to understand is a lot of genetic influences there. So some family member has a cancer, that does not mean your child is going to get cancer, right? They might be related to different kind of cancer in a different context. So don't think that okay, when family member is affected with cancer, child is going to get cancer, right? So that is very important. So now I think you have already covered a lot of concepts about this cancer, what happens in the treatment, follow up, what happens. Now I think the parents then they will definitely ask. I have also seen that okay, is there anything I can do to prevent occurrence of cancer in my child?
Yes. So there is not a lot we can do to prevent cancer in children, because most of the time we have to consider this as a random event which happened. But definitely healthy lifestyles in terms of eating a healthy food, having a good sleep, doing reasonable physical exercise, and all those things, what you would normally do to keep yourself healthy, what we will consider as a healthy lifestyle, that needs to be encouraged. But other than in specific situations where we do some surveillance to see whether the cancer coming back in specific genetic conditions, overall there is nothing very specific about preventing the cancer. And also if unfortunately somebody in the family has developed a cancer in childhood, most of the time there is no reason why it developed, and parents don't have to blame themselves that they have did this right, that wrong, or that is why the child has developed cancer. But most of the time you could not have done anything different about it.
Okay, so it's mostly something like a random accident kind of thing.
Yeah, so exactly. So sometimes when the parents ask, I use this term. I will say, we don't know why your child developed a cancer, but all I can say is, if I have to explain it in one word, that is just bad luck. Some child would have developed a cancer. Unfortunately, it happened to be your child. There is nothing you have done wrong, or you have did anything to make this happen.
Got it. I think we hope no child gets diagnosed with such kind of illness. But yes, unfortunately, if it happens at any point of time, the main thing what we can do is seek for care early, meet the relevant team, relevant specialist, and get the appropriate care. So now that we have seen so much has happened in the last 40 to 50 years, which has increased the survival up to 90%, which is I think amazing. So what are the recent recent development that have come that have changed the way diagnosis or treatment or anything?
So when I say 90%, it is not in all cancers, in many cancers. But there are also some cancers still the survival may be in the range of 30% or 40%. So it is quite a spectrum, but overall majority of the childhood cancers now it is like crossing 70%. So that is the sort of current survival figures. And in terms of the recent advances, I mean, obviously things have improved over the last 50 years, 60 years, and it is continuing to improve. So there are a lot of new things which have come up in the last several decades or so. So I can sort of give some examples. I mean, it has occurred in every different field of cancer. For example, now we have really gotten good at sort of stratifying the cancer, in the sense classifying them, putting them into groups, who is low risk, who is high risk, even within one particular cancer, so that it so we try to give less treatment for those who are at a good risk, and more heavier treatment for those who are at a higher risk, so that eventually we give targeting the right amount of treatment for this right patients. This actually has made an enormous difference, because if you give heavy treatment for everybody, some patients might die because of the treatment. If you give light treatment for everybody, then some cancer will come back because you have not treated them adequately. So at the time of diagnosis or very early on in the treatment, if you can kind of classify it and stratify and then give the right treatment, then that is very good, and that is one of the major improvement. And in leukemia, something called as MRD, or minimal or measurable residual disease, where after the first month of treatment, we take a bone marrow sample and sort of look at how much cancer is left behind. Previously, we were too crude, we just had to look under the microscope. Now there are special techniques where they can detect a cancer cell in 1 in 10,000 or even 1 in a lakh cell, and that has made a huge difference in terms of the outcomes. And another important aspect is the supportive care, what we call as because the amount of treatment you can give depends on how we can manage the side effects and complications. So now the pediatric intensive care has really improved, which will allow us to give a lot of sort of strong treatment because we are confident that we can manage the complications, and that also has improved the outcome quite significantly. And in addition, there are like a lot of new medications have come. Say for example, immunotherapy, where there is antibodies against the cancer cells, which is something quite new. Newer advances in the radiotherapy techniques and things like proton therapy, and so all those things have really helped in terms of how we are dealing with the cancers. The whole idea is to increase the success rate of the treatment and reduce the side effects and reduce the long-term side effects. So this is how the treatment is progressing all the time.
Yeah, I definitely agree with Dr. Stalin that the overall advances in treatment, one is core cancer treatment, and when we come to this intensive care management, the supportive treatment, all these are rapidly improving at rapid pace in the last maybe 5-10 years. So definitely with the advent of the latest technology, it's still going to further increase into the survival, and even those cancers who are like 30-40% survival rate is there, maybe they also are going to fare better in future. I think we spent a good half an hour on creating awareness on this important topic on cancer. I'm sure Dr. Stalin has busted few myths, which I think that is the important take-home message. Take-home message is that don't think cancer is not common, and when it is comes to a stage when a child is not well, not responding, always meet a pediatrician, discuss. There can be a possibility. There can be a possibility of other immune disorders or other infections. Cancer is also one among them. When the child is not responding as to what we expect, so definitely at the right point of time, referring to right specialist is what going to make a huge difference going forward, right? And coming to the way it is managed, like the way it is diagnosed, the way the modalities of treatment, the chemotherapy, the radiotherapy, even the all kind of investigations that are available, and the supportive care, all this is going to make sure that the cancer is treated to whatever maximum extent possible. Definitely, I know it's going to be stressful and traumatic, but with the right team, I'm sure that it's going to be a good outcome for the child. I think I thank Dr. Stalin for this good discussion we had, and I'm sure our audience would have got a few points from this to make sure they remember when to suspect, when to reach out to your pediatrician, and get the appropriate care. Thank you. Thanks a lot.
Thank you very much, Dr. Gupta,
Thank you very much.
Thank you very much.